Hello, everybody. This is Dr. Bob and Dr. Anthony DiMaria. We're excited to give you some information about allergies and those runny noses.
So, Dr. Bob, a common question is, why do people have allergies?
You know, Dr. Anthony, that is a tremendous question, and this is a trick question for all of you out there right now. Do we breathe the same air? Dr. Anthony and I breathe the same air. I don't have allergies. He does not have allergies. Our family doesn't have allergies. So there must be something that we are doing different than you're not doing. And probably since 1978, that is the question of the century. Dr. Bob, why is my nose running? Can I take this kind of over-the-counter medication? And this is what I find out so many times. 2 or 3 main reasons. You could definitely have an alignment challenge on your second cervical vertebra. For some reason, we notice that that second cervical vertebra is impacted or impacts the sinuses and the nerves to that area. But we also know, Dr. Anthony, that what everybody is eating also impacts what happens. So we have this digestive system down here. You want to make sure that you're digesting your proteins properly. That means you need to have enough digestive enzymes. And we will do a test called the opti-chem profile, and your blood globulin level should be 2.7. If it's above that, probably you're not breaking down your proteins like you should. The 3 or 4 most common foods that people seem to be sensitive to: peanut butter, dairy, wheat, and the culprit that compromises the immune system, sugar. Sugar will compromise your immune system.
So, Dr. Bob, why do over-the-counter allergy medications not get to the root of the issue?
You know, it's very interesting because most of them are antihistamines. Check that word out, antihistamine. So why do you think your body is creating fluid? Because it's under attack and it's trying to dilute those toxins. When you go to a big box store or a pharmacy and you find your favorite that's been advertised to you that this particular one, Dr. Anthony, takes care of 5 symptoms versus 1 symptom, etc. They're tricking your body. So let's drill back a little bit to find out, why are you having a histamine reaction? More often than not, it's because you're not digesting properly. And do you know, in your small intestine, that's where histamines break down. There's something called the histamine factor or the antihistamine factor. So we actually sometimes need to suggest that or promote that to help metabolize all those histamine challenges that you're having in your body.
Okay, so maybe to summarize, or just in some simple points, if someone has allergies, what should they do?
If you have an allergy right now and you have a runny nose, the first thing you want to do is evaluate how much dairy are you consuming, how about peanut butter, how much wheat are you consuming. If those are a big part of your everyday routine, I would back off, starting with dairy and then the peanut butter and then the wheat. But one other area, little secret: if you have cold hands and cold feet and you have what they call seasonal allergies, it's also possible, Dr. Anthony, that they could have an iodine deficiency and maybe a low thyroid gland, which we would do some thyroid blood tests.
Okay, so Dr. Bob, what about nutrition? Are there any type of nutritional support or something that you could do in order to help the body fight allergies naturally?
Well, the number one area that we always try to focus on, it comes down to digestion. We use a product in our practice called Hydrozyme. Hydrozyme is a digestive enzyme that we encourage our patients to use mid-meal. So that gets to the root cause to help break the proteins down. But we also use a product called Histoplex AB, and it's a proprietary blend of ingredients designed to help manage the symptoms caused by maybe some poor food choices and or some sensitivities. That's pretty amazing, isn't it?
So if you enjoyed this information, check out our other videos on allergies and a variety of topics. I know that you'll be glad you did.